Now to St. Louis, where COVID-19 hospitalizations are breaking records daily. According to the city's regional COVID-19 task force, more than 900 COVID-19 patients are hospitalized in the metro area, and 90% of ICU beds are full. NBC News correspondent Ellison Barber joins us now from a hospital just outside St. Louis that has been hit especially hard. Ellison, thanks for being with us this morning. Now, this question is honestly hard to ask without getting upset, but I know from your reporting that in the last 2 weeks, hospital staff there say they've sent more ICU patients to the morgue than home. You were able to spend time on the ICU floor. Tell us about what you saw while you were there.
Yeah, a week ago, they were actually having to put 2 ICU patients in each room, COVID patients, because they simply did not have the space. They were doubling up their rooms. That is not the case right now. And we're told that's not because they were able to send a lot of people home, but because in the last 2 weeks, so many patients have died. They do have an on-site morgue here, and that morgue was too full, and they had to bring in a refrigerated truck late last week that is now in use to keep some of the bodies here because they do not have the space. We were able to go inside onto the ICU floor where most of the patients were COVID positive, though some of them were not, and we were able to see some of the things that the doctors and the nurses are dealing with right here. And right now, we saw many patients who were sedated, many who had to be placed on or were already on ventilators. We saw patients in what's known as the proning position, where doctors, nurses, healthcare workers have to put the patient on their stomach because that is the only way they can get the air to their lungs by themselves. We saw staff working to take a person out of that position. It's eerily quiet when you're inside because so many people are in such bad shape, poor condition. Sometimes people ask, I think people expect ICU floors like that to be kind of like what people see on TV, but it's not. It's quiet. It's heartbreaking because so many patients are unable to speak, unable to move, and they don't have their family with them right now because of the situation with COVID-19. There are also patients, again, who do not have COVID, who need care. While we were inside at about noon, one patient, a non-COVID-19 patient on the ICU floor, coded. The video that we're going to show you is very, very hard to watch, but we're showing it to you because I think it's important for people to understand what the doctors, what the nurses, what the healthcare staff are up against right now as they have more people coming into their hospital needing critical care because of COVID-19. The other emergencies, the other serious medical issues, those have not stopped either. Watch.
One side. Attention, please.
Start ultrasound. Where's our dashboard?
Yeah, you can pull.
I need to break ultrasound.
As those doctors and nurses were fighting tooth and nail to bring that patient back and save that person's life, you might have noticed how many people were there working in that room. It was at least 10. That's the type of team, the staff, that critical care like this needs. And when doctors, when they are talking about capacity and worried about being overwhelmed, they're not just talking about the number of beds and physical space. It's about the medical professionals they have to give the care that is necessary. This sort of care, when people have severe cases of COVID-19 or other medical emergencies, all of it takes a lot of people. And at some point, the numbers of doctors, the number of nurses, the number of other healthcare assistants, that's limited. And that's what hospital after hospital is so worried about when they're talking about capacity. They need a lot of people to give the care that people with severe cases of COVID-19 or other serious medical conditions need. Savannah?
Ellison, obviously we can see in that video that it's got to be exhausting both mentally and physically for them. One of my best friends is working in an emergency room in Denver, Colorado. She says she's crying multiple times a week. She's never like that. What are they telling you?
Yeah, I was asking the doctors and nurses we talked to how they handle the burden, and a lot of them will tell you that this is what they feel called to do. They know what they signed up for, but this is taxing, and it's not getting any easier. They have been doing this for 9 months now. This is the second big wave for this hospital, and in the St. Louis region, this hospital has dealt with the brunt of the COVID-19 cases, and their nurses, they are struggling mentally. Listen here.
We have gone from a stressful work environment to a trauma work environment. So now I need to have support groups for my teams, for them to be able to unpack, if you will, the emotions that they're feeling, the amount of death that they're seeing, for them to realize that their efforts are not futile, that they are making a difference, that we are discharging patients.
So across the state of Missouri, statewide, the total number of daily new COVID-19 cases is in a plateau, though hospitalizations and deaths are still in an uptick. In the St. Louis region, though, the St. Louis metropolitan region, they aren't just seeing an uptick in hospitalizations and deaths. They have broken records for 4 days in a row now. Savannah?
Ellison, amazing reporting. Thank you so much.